Thank you everyone to join us this evening, and I will give you my experience about endoscopic spine surgery. And thank you to Mike Budek and Optima Surgical to help arrange and set up this meeting. Next slide, please. I have non-disclosure for this topic that we'll be talking about today. And this is my short bio. So I'm currently a spine surgeon in Scottsdale, Arizona. Microspine is my practice. And basically I am doing endoscopic and minimal invasive spine surgery, amongst others, spine surgeries. And I graduated from a residency program in Virginia, Richmond, Virginia, at Virginia Commonwealth. And I had a neurosurgery fellowship training at Stanford University, and another orthopedic spine fellowship trained at Texas Back Institute. And now I'm in Scottsdale, Arizona, practicing spine surgery. Next slide, please. So the goals of the topic today or meeting today is to have better understanding of what is endoscopic spine surgery and why endoscopic spine surgery. What are the benefits? What are the conditions we treated? And typical course of post-op or post-surgery expected outcomes. Basically, I want you guys to know the options that not just a fusion surgery that is needed. Next slide, please. So like I said, know the options. So historically, the traditional open surgery is the surgery that we've been trained to do. It serves the purpose of treating the spine problems, but there's a lot of collateral damage. For example, the incision is bigger, we have significant blood loss, a lot of collateral damage to the soft tissue and especially the muscle. We have to remove the normal structures to get into the area that we want to treat the patient. Longer hospital stay, significant post-op pain, and longer recovery. So that's kind of the traditional open surgery that I or almost spine surgeons have been trained to do it. But I think there's a better way to do it nowadays. Next slide, please. So think about the industry around our daily living. The healthcare industry, or especially spine surgery, is probably the least advanced of all. For example, you have a car, right? And if your car broke or you need to repair it, then you go to find a specialist to repair it in the least invasive possible way, right? So that you save the money, your car is running good, no problems after that, they have warranty and whatnot. Next click, please. Nobody doing this type of repair for the car, correct? Meaning that we not just get everything open up and try to find what's wrong with it and fix it. But this is type of the spine surgery that's being done nowadays, meaning that we doing open surgery, find out the problems, and we try to put it back together. So I think that's kind of not the way that I want to be treated. Next slide, please. And even within the surgery itself, the spine surgery is the least advanced among all the others. For example, nowadays, nobody doing open surgery for the knee to fix the meniscus or repair the ligaments. So we have knee scopes, we can repair to the scopes, we have shoulder scopes, and even appendicitis. Nowadays, nobody doing the open appendectomy. Everybody's going to a laparoscopic or endoscopic spine surgery. So the technology is evolving, including the spine surgery, even though it's kind of slow development, but it's there. Next slide, please. So before we change anything, we have to ask ourselves why. And why endoscopic spine surgery for me is because it's best for the patients in my hands. I've been doing open surgery, mini open surgery, minimal invasive spine surgery through a bigger tube. And now I offer my patients endoscopic spine surgery. And I think it's best for my patients. The benefits of the endoscopic spine surgery is that it's very precise. You target the problems and you fix it. It can be done through a very small hole, about 1 centimeter, very minimal soft tissue damage or collateral damage, minimal blood loss. 90% you can do it in outpatient surgery, and very minimal post-op pain. Some of the patients just need Tylenol, ibuprofen, and things like that. Quicker recovery and faster return to work. And this is all the benefits outweigh the risk. And that's why I think in my hands, endoscopic spine surgery is the future of spine surgery. Next slide, please. What is the endoscopic spine surgery exactly? So the endoscopic spine surgery is the surgery that we as the surgeons treat the spinal problems through a very precise, very small incision. So we use the special high definition, high magnification camera along with the special tools or equipment to perform the surgery that needed to be done. And this, in the past, we did it through an open surgery. And nowadays we don't have to. Next slide, please. What types of problems or conditions that can be treated with the endoscopic spine surgery? I think majority of the spine problems can be treated with the endoscopic spine surgery. We can treat sciatica symptoms, herniated disc, bulging disc, annular tear, spinal stenosis or pinched nerve, arthritis or bone spur that are compressed on the nerve. And even nowadays, we can do the fusion surgery through the endoscopic fusion. And like I said, many spine problems can be treated in this with the endoscopic spine surgery. Next slide, please. There are still a role for open surgery, and endoscopic spine surgery is not appropriate for the patient who has cancer, tumor, spinal infection, severe deformity, scoliosis, fracture, broken bone, things like that. But those subsets, I think, need to be treated delicately with the open surgery. Next slide, please. So this is the typical post-operative course for my patients that had endoscopic spine surgery. First, it can be done as outpatient, meaning that we discharge the patient home the same day. They have to show me that they're safe to go home, meaning that they have to be able to get up, move around, sit, stand, walk in the recovery room. Pain is controlled, no major issue after the surgery. Usually they'll stay in the facility for a couple of hours before they will discharge home. They can return back to work, desk-type job, sedentary work within 5 to 7 days, driving probably within 7 days. and then they can do gradually doing low impact exercise such as walking, hiking, stretching, light yoga within 2 weeks. The patients who are doing a lot of physically demanding work, I probably recommend that they can return to work about 4 to 6 weeks. Playing sports is one of the main reasons that people seek endoscopic spine surgery. And in Scottsdale, Arizona, or in Arizona, because of the weather is so nice, everybody loves playing golf. So I told my patient that at week 3 they can putt, week 5 they can chip, and week 6 and thereafter they can do drive or swing golf. Yeah. Next slide, please. So many patients ask if there's any evidence or data that support endoscopic spine surgery. Yes, there are tons of data supporting the outcomes and the superiority of the endoscopic spine surgery. Most of the paper or data come from Asia and Europe, because in Asia and Europe, the endoscopic spine surgery is almost a gold standard or a basic standard for treating the spine problems. In North America, it's still far behind. Just this month alone, February 2022, there are 2 papers talking about the outcomes of endoscopic spine surgery. And basically, the bottom line is that it's not inferior, and in many studies, they are superior outcomes comparing to the open surgery or some other types of minimal invasive spine surgery. Click, please. So that's what I'm talking about. The outcomes are not inferior, and many studies show superior outcomes. Next slide, please. Talking about the risk, so surgery is not risk-free. So the patient has to understand the risk. And specifically with the endoscopic spine surgery, the risk are running between 1 to, I would say, 8%. For example, the dysesthesia, meaning that the tingling numbness after the surgery is about 5% to 8%. Dural tear or spinal fluid leak is about 1% to 4%. Infection is about 1.5 to 2.5%. Recurrence disc herniation or recurrence of the symptoms about 7% to 8%. There's a chance that we have to convert to an open surgery. It's about 3% to 4%, and about 1% to 4% incomplete work from the surgeons. Click, please. The bottom line is that the risks are comparable to open surgery or some other type of minimal invasive spine surgery. And in many studies, the risk in endoscopic spine surgery is even lower. So that's, I think, it's good news. Next slide, please. So I just want to show you some of my patients, some of the case. And this is a real case. So basically, this is a 25 years old male college student from Yuma, which is about 3 to 4 hours from where I practice. So this gentleman has 3 years of severe right sciatica symptoms. He can't attend his class, and he can't even perform his daily activities. Pain scale is 10 out of 10, and he has been through several months of physical therapy, multiple injections, pain management, and it gave him no relief. And the MRI, which is on the right side of this slide, showing a large herniated disc that black stuff that's sticking out, coming from L4-5, and it's severely compressed the nerve, and that's why he's in so much pain. So he came in with his family. We talk about the risk benefits and what can I offer him. So I offer him the endoscopic spine surgery to address his problems. Next slide, please. This is the him before the surgery in the hotel. The day of the surgery.
Say hi. Hello, Mike. This is before. We're going over for surgery today. Okay.
Can you stop the slide? So you can see how he walked. He can't even straighten up his body. And he has to use walker at 25 years old because the pain is so severe. And so this is the day in his hotel room, the morning before the surgery. Next slide, please. And this is the endoscopic view, meaning that we are inside your spine during the surgery. And this is at the very end when I finish the surgery. So that's the endoscopic view that we can see. And you can see the free nerve, and you can see the hole in the disc after we remove the nerve, remove the disc. And on the right side is the size of the disc that we remove through a small hole, about 1 centimeter incision. And this can be done. And next slide, please. And this is him 3 hours after the surgery, back in his hotel room. So the background voice is his father and his mother. So they're pretty happy. And the right picture is his incision that we did the surgery. So it's about 1 centimeter. It's even smaller than my thumb. So that's my thumb. Next slide, please. So in conclusion, I think endoscopic spine surgery is the innovative technique, and it's the least invasive possible way that nowadays allow the surgeons to address the spinal problems. And in my hands, I think it's best for my patients comparing to open surgery, mini open surgery, or even a tubular surgery. So I think it can be done. Next slide, please. And this is my practice, meaning that I am passionate about non-fusion surgery, endoscopic spine surgery, artificial disc, Coflex device, but I'm still doing fusion surgery if they are indicated. And I can do fusion surgery through a minimal invasive tubular type surgery, or even with the endoscopic spine surgery. So I think that is pretty much it for my presentation. And thank you for attending the meeting, and I am open to any questions.